The White House is sending 1,000 military personnel to help hospitals overburdened with COVID patients in 6 states. The medical teams are being deployed to New Jersey, New York, Ohio, Rhode Island, Michigan, and New Mexico. Many medical facilities are struggling as the country grapples with surging hospitalization numbers amid the spread of the Omicron variant. Infectious disease specialist Dr. Amesh Adalja is here to discuss the latest pandemic news. He's a senior scholar at the Johns Hopkins University, Bloomberg School of Public Health. And Doctor, thank you so much for being here today with us as we talk about help being sent to these overburdened hospitals in a number of states. How are you and your colleagues managing things where you are in Pittsburgh 2 years into this pandemic?
What we have are a lot of unvaccinated people that have high-risk conditions that put them at risk for severe disease. That's primarily what we're seeing hospitalized, and that was true during Delta. What Omicron has done has increased the number of cases in a hospital, including people who are testing positive when they're there for some other reasons. And you have to integrate that all around the idea that we have problems with staffing. Hospitals are having a hard time just having enough nurses to staff units. So it's less about physical space and more about people right now. And I think we've got pandemic fatigue going on as well. It's a lot of conglomerations of factors that are making it very difficult in hospitals. But it's not universal. It's more in rural community hospitals than it is in the big city hospitals. And I think it really directly reflects the fact that, as I said earlier, that there's still not enough people vaccinated that have high-risk conditions. And Omicron is very unforgiving when it comes to spread.
So we've been talking about this all morning long, that the Supreme Court has blocked President Biden's COVID-19 vaccine testing mandate that he wanted for large businesses with more than 100 employees. Now, businesses on their own could decide that they want their employees to either be vaccinated or test on a regular basis. But at this point, it won't be mandated by the federal government. Obviously, it's a setback for the Biden administration, but do you think it's a setback for us when it comes to getting over this pandemic?
The more people that are vaccinated, the quicker this pandemic goes into our rearview mirror. I've always had some problems with the OSHA route that the president took because I thought it was likely to get blocked by courts. And I think it's much better when private businesses themselves decide this. And I consult for many private businesses, and I do recommend they issue vaccine requirements as a condition of employment or a condition of participation. I feel that the OSHA way that the president took was bound to get into this kind of political atmosphere and end up being ultimately unsuccessful. I'm glad, though, that the CMS recommendation, the one that if you take Medicare and Medicaid dollars at a healthcare facility, that your healthcare workers have to be vaccinated. I think he was on much stronger footing there. And indeed, that one was upheld by the Supreme Court. So I think it's really imperative that healthcare workers be fully vaccinated.
And parts of the country that were hit first by the Omicron variant, I'm thinking of New Jersey, Washington, D.C., are now seeing a decline in new COVID cases. Does that mean that we are nearing a national peak of the Omicron wave, or could there be other factors to this decline, Doctor?
Well, we know that Omicron seems to cycle much faster than other variants, where it's on a scale of weeks versus a scale of months. And the data that we're seeing from Boston, New York, New Jersey is encouraging. The cases are starting to collapse. But remember, the whole country isn't on the same timeline. So it's going to be some time before the country as a whole gets through the Omicron peak. But clearly, some of the cities seem to be decanting the number of cases. We'll have to see how the next couple of weeks go because hospitalizations and deaths are going to lag cases. But I do think that this is going to be a relatively quick wave. And hopefully at the other side of this, we'll be in a much better place, have much more access to rapid tests, much more access to monoclonal antibodies and the Pfizer antiviral.
You know, since a vaccine has been made available, there have been questions about pregnant women. And, you know, talk to any doctor, and I'm sure you will say that if you're pregnant, you should get vaccinated. We know what the vaccine does. It protects you and your baby. We don't know what COVID will do with, you know, the way you'll be affected by COVID. So we're finding out more about the way the impact that COVID has on pregnant people. There's a new study by scientists from Scotland's Public Health Agency. And it suggests that although pregnant women do not seem to be more susceptible to the infection than non-pregnant women, they are at a higher risk of severe COVID. What can you tell us about, you know, just how this virus works and impacts pregnant people?
You have to think of pregnancy as a high-risk condition for many infectious disease. Indeed, we've seen this with influenza, that pregnant women who get COVID-19 are more likely to be hospitalized, more likely to need ICU care, more likely to need a C-section, more likely to have preterm labor, more likely to have a stillborn baby. All of that's been shown. So I do think it's a high priority to get pregnant women fully vaccinated, because it will protect their pregnancy, it will protect them, and it will also cause their newborn to have antibodies that are passed through the placenta and protect the newborn, as well as through breastfeeding and the antibodies that pass through breast milk. So pregnant women should be among the highest priority groups for vaccination. Unfortunately, though, there's so much misinformation out there that's dissuaded pregnant women, and we even know of hospitals that are excluding pregnant women from their vaccine requirements. This misinformation needs to be debunked, because it's actually costing lives and causing people to put themselves in harm's way.
On a less serious note, a few friends asked me about this other report from Oregon State University that suggests that cannabis compounds found in hemp can keep COVID-19 from entering human cells. However, vaping and smoking marijuana will not fight off infection. Help us understand this study and put it in context if you can, please.
You have to realize that there are many different compounds that, when you work in a petri dish or in a laboratory setting, are able to block the ability of the virus to infect cells. And that doesn't necessarily translate to something that you do yourself. There's a big gap between what we would call in vitro studies and in vivo, in people. And we know that smoking marijuana, vaping, because it is an inflammatory irritant to your lungs, can actually make you more susceptible to COVID-19, because it's going to inflame your airways. So marijuana is not something you should be thinking about in smoking marijuana for prevention of COVID-19. This is an interesting study. Maybe that leads to new compounds down the line. But remember, there's a big gap between what happens in a laboratory and what happens in real life.
Dr. Amesh Adalja, you just disappointed a lot of people, I'm sure, but thank you.
Thanks.